Okay, Molly, so what I want you to tell our viewers at home here is what brought you here to me for treatment. What's been going on and how long has it been happening?
I've had chronic RSD nerve pain for 14 or 15 years. Treated with pain medications, pain pump, spinal cord stimulators, and still kind of ended up in the same position of chronic pain. No mobility in my joints, unable to do physical activities, not able to sleep, just kind of affect all of my life.
Yeah. So you got a spinal cord stimulator coming in here, right? Like
yes,
you used to
two. I have two spinal cord stimulator implants.
I thought you just had one. I had two. And also a pain medication pump, right?
Yes.
Using that. Okay.
Yep.
So on a where was the biggest problem? What side of your body was the biggest problem?
I had the most pain in my right knee, leg, and right elbow.
Right elbow. Okay. So we came in and we examined you, and I told you that I thought you probably had more of a brain problem, probably a parietal lobe thing, and we've been doing some therapy for that. So what is different over these last 4 days? First of all, do you feel better?
Yeah, absolutely. I feel better.
Tell us how you know you feel better.
Well, I've gone 13 hours now without my pain medication, which I usually go 4 to 5.
How many days in a row have you done that?
4 days.
4 days in a row where you've not had to take your morning and kind of middle of the day
afternoon dosages.
So that's one way we know.
Yes.
Right? What else have you noticed?
I can have my joints touched where I couldn't before because the pain was too bad. I have more mobility and more comfortability just sitting, walking, moving.
Cool. And you're still not off completely your medication because you're taking some pain medication because you can't turn off the pumps. But even with those on, your pain level wasn't really all that controlled. So I guess what I'm getting at, you were on those things and you were having problems having people touch your elbows and your knees.
Yes.
But not using half the medication, we are able to touch your elbow and your knee now.
Correct.
And that's good. Okay. So just, not want anyone to think this is some kind of miraculous thing. It's not like she's 100% better. And in fact, if you were going to be here for another week or two, we would continue to do what we're doing. But you're going to go home with some directions and a good doctor who's going to help you. Give me like an overall, like just if you had to say, this is how much better I feel.
I would say right now, I feel about 50% better as far as the sensitivity, the pain, and the mobility goes.
Right. And that's without taking...
Without the medication, oral medication.
Oral medication. How long has it been since you felt this little discomfort? So like the level you're at now, how long has it been since it's been that low?
Oh, it's been 5 or 10 years.
5 or 10 years.
Easily.
Okay, cool. So do you have any words of encouragement or wisdom for someone who's diagnosed with, by the way, I want to reiterate this, RSD, Reflex Sympathetic Dystrophy. They call it a different thing now. They call it Complex Regional Pain Syndrome. So either RSD or CRPS, do you have any words for those people? I mean, I'm curious what you would tell them.
Well, personally, I got to a point where I just felt like the medications and all of that was all there was. And then I got to another point where I realized it can't be all there was. And so after this, I feel like there's that hope out there that this isn't something that you have to live on the medication day after day.
Yeah. There is something you can do about it, probably.
Absolutely.
Cool.
Yeah.
And we ain't even done yet.
Right.
So that's cool.
Yep.
All right. Well, thank you. We'll hopefully follow up with you again in the future, and you'll tell us you're doing even better. I want you to go running again.
Exactly.
Yeah.
100%.
So we know you can visualize it. We're going to make you do it, right?
Right.
Cool.
Yeah.